One.
Hi, my name is Haley Wade, and this is for Mod 4, and it's going to be my head-to-toe assessment. Alright, so we're going to knock on the door.
Come in.
Hi, my name is Haley. I'm your nurse today. Can you provide me with your name and date of birth?
Christine Wade, date of birth is 12/25/66.
Okay. Do you mind if I provide privacy?
No, I do not mind.
Alright, providing privacy. And we're going to do the head-to-toe assessment today. I'm just going to wash my hands. Is that okay?
Perfectly fine.
Let's go wash hands. Alright, so we're going to turn on the faucet. Put the soap, and now you want to do in circular motion. Get in between, get underneath the fingernails. You want to do the wrist. Alright, I'm going to face down. Get all the germs off. And with a paper towel, you're going to pat, not rub, to dry your hands. And with a different paper towel, you're going to turn off the sink. Now we're going to throw this away. So I'm going to ask you a couple questions beforehand. What season is it?
It is summer.
Okay. Do you know where you are?
Yes, I do. I'm at Lincoln Hospital.
Yes. And do you know who the president is?
Yes, Trump.
Okay. And do you know what month it is?
Yes, we are in September.
Okay. So I'm going to apply gloves. I have my gloves on. Can you take off your sunglasses, please? Alright, I'm going to palpate. Make sure there's no lesions or contusions. Now, do you have any dizziness?
No, I do not.
Any headaches?
No, I do not.
And overall, do you have any pain?
No, I do not.
Okay. Alright, so everything looks good. So we're going to move down to the eyes. Can you raise your eyebrows for me? Perfect. Alright, and do you wear glasses at all?
Yes, I do.
Perfect. Alright, so first we're going to see her pupil size. Alright, and she is a 4. Good. Now I'm going to have you follow the light. Well, follow the pen. Just don't move your head. Good. Now I'm going to see how your eyes relax to light. Just look straight at me. Good. Everything looks good. Both her eyes are symmetrical and equal. So now we are going to move down to the ears. Any earaches that you're experiencing?
No.
Okay. Alright, so her ears have no drainage in them, which is good and normal. Alright, so I'm going to have you do the nose next. So I'm going to have you look up. Perfect. No deviated septum. And her nose is symmetrical. Now I'm going to have you puff out your cheeks. Okay, you can let the air out. Can you smile? And frown. Good. Can you stick out your tongue and say ah? Alright. Everything looks good. The mouth is pink and moist. So now we are going to go down to the neck. So I'm going to feel for any swollen lymph nodes. Good. And check to see how her GVD is. I'm going to actually have you lean back. Alright, her GVD is good. Let's check skin trigger. Alright, not dehydrated. So next we're going to do range of motion. So can you go like this with both hands? Perfect. Can you roll your wrists? Can you push against my hands? Good. And I'm going to check your capillary refills to make sure they're less than 3 seconds. Good. Perfect. Any pain you're having?
No.
Perfect. And there's no bruises or contusions on her arm, which is good. Alright, now we are going to go down to the lungs. Any shortness of breath you've been having lately?
No.
Any problems with your lung areas?
No, I do not.
Okay, so I'm going to have you sit up. Now I'm going to listen to your lungs. I'm just going to have you breathe in and out normally. Perfect, just breathe in and out. Now we're gonna do bilateral. Now we're gonna do back. Alright, so anterior, posterior, and bilateral, all clear. No crackles, no wheezing. And now we're gonna move on to the heart sounds. So first we're gonna start with aortic, which is the second intercostal space on the right sternum. And next we're going to go to pulmonic, which is the second intercostal space on the left sternum. Good. Then we're going to go to Erb's point, which is third intercostal space on the left sternum. And lastly, we are going to go to mitral, which is mid-clavicular line, fourth intercostal space. We're going to stay here for a minute, and we're also going to do her apical pulse at the same time. Good. Alright, so her apical pulse is within range. There's no arrhythmias, which is good. So next we're going to move down to the abdomen. Any problems with the abdomen?
No.
And do you have any trouble in the bathroom?
No.
And what color do you think your urine is?
It's almost clear.
Okay. Any cloudiness?
No.
And what about going to the bathroom? Any constipation?
Nope.
Is it solid?
Sometimes.
And is it brown?
Yes.
Okay. So I'm going to have you lay down. Alright. Now lift up your shirt a little bit. Alright. Now we're just going to check to see if there's anything wrong, any lesions or anything. Everything looks good. Alright, so we're going to listen. We're going to listen to the right lower quadrant first, and we're going to listen to that for a full minute. So that is within normal limit. So in the normal range, so then we would go up to the right upper quadrant, listen to that for a full minute. Then we would move over to the left upper quadrant and listen for that for a full minute, along with the left lower quadrant, and we listen to that for a minute. Alright, so I'm gonna help you. Tell me if you have any pain. And we're going to percuss. No pain or tenderness, no? So I'm gonna have you stay right here. So I'm gonna have you lift this leg up and hit my arm, and have lift this one. Good. Now I'm gonna have you push against. Perfect. All right. So I'm gonna have you swing back around. Raise it up. Okay. So next we're gonna check to see if the patient has any edema. Alright. No edema. Any pain in the legs at all?
No.
Okay. And then we are going, do you mind taking off your shoes? I just need to check for the pedal pulses. Alright, then you're gonna locate the pedal pulses. Make sure you find them. Perfect. Alright, now we're going to do the capillary refills for each one of the toes. Perfect, and they're all less than 3 seconds. Alright. Now I'm going to have you stand up. We're going to do a short walk. And we're going to walk to right here and turn around. Alright, and head back. Alright, and take a seat. Anything going on that you want to discuss? Alright, and the doctor will be right in.
Okay, thank you.
And that's the end of the head to toe. You can stop it.